Type 2 diabetes is an impairment in the way the body regulates and uses sugar, glucose, as a fuel. This long-term, chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into your cells, and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult-onset diabetes, but both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. There's no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise aren't enough to manage your blood sugar, you may also need diabetes medications or insulin therapy. Signs and symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually in the armpits and neck. Type 2 diabetes is primarily the result of two interrelated problems. Cells in muscle, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take in enough sugar. The pancreas is unable to produce enough insulin to manage blood sugar levels. Exactly why this happens is unknown, but being overweight and inactive are key contributing factors. Insulin is a hormone that comes from the gland situated behind and below the stomach, pancreas. Insulin regulates how the body uses sugar in the following ways. Sugar in the bloodstream triggers the pancreas to secrete insulin. Insulin circulates in the bloodstream, enabling sugar to enter your cells. The amount of sugar in your bloodstream drops. In response to this drop, the pancreas releases less insulin. Glucose, a sugar, is a main source of energy for the cells that make up muscles and other tissues. The use and regulation of glucose includes the following. Glucose comes from two major sources, food and your liver. Glucose is absorbed into the bloodstream, where it enters cells with the help of insulin. Your liver stores and makes glucose. When your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. In type 2 diabetes, this process doesn't work well. Instead of moving into your cells, sugar builds up in your bloodstream. As blood sugar levels increase, the insulin-producing beta cells in the pancreas release more insulin. Eventually these cells become impaired and can't make enough insulin to meet the body's demands. In the less common type 1 diabetes, the immune system mistakenly destroys the beta cells, leaving the body with little to no insulin. Factors that may increase your risk of type 2 diabetes include weight. Being overweight or obese is a main risk. Fat distribution. Storing fat mainly in your abdomen rather than your hips and thighs indicates a greater risk. Your risk of type 2 diabetes rises if you're a man with a waist circumference above 40 inches, 101.6 centimeters, or a woman with a measurement above 35 inches, 88.9 centimeters. Inactivity. The less active you are, the greater your risk. Physical activity helps control your weight, uses up glucose as energy and makes your cells more sensitive to insulin. Family history. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes. Race and ethnicity. Although it's unclear why, people of certain races and ethnicities including Black, Hispanic, Native American and Asian people, and Pacific Islanders are more likely to develop type 2 diabetes than white people are. Blood lipid levels. An increased risk is associated with low levels of high-density lipoprotein, HDL, cholesterol, the good cholesterol, and high levels of triglycerides. Age. The risk of type 2 diabetes increases as you get older, especially after age 45. Prediabetes. Prediabetes is a condition in which your blood sugar level is higher than normal, but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Pregnancy-related risks. Your risk of developing type 2 diabetes increases if you developed gestational diabetes when you were pregnant or if you gave birth to a baby weighing more than 9 pounds, 4 kilograms. Polycystic ovary syndrome. Having polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, excess hair growth and obesity, increases the risk of diabetes. Areas of darkened skin, usually in the armpits and neck. This condition often indicates insulin resistance. Healthy lifestyle choices can help prevent type 2 diabetes, and that's true even if you have biological relatives living with diabetes. If you've received a diagnosis of prediabetes, lifestyle changes may slow or stop the progression to diabetes. A healthy lifestyle includes eating healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Getting active. Aim for 150 or more minutes a week of moderate to vigorous aerobic activity, such as a brisk walk, bicycling, running, or swimming. Losing weight. Losing a modest amount of weight and keeping it off can delay the progression from prediabetes to type 2 diabetes. If you have prediabetes, losing 7% to 10% of your body weight can reduce the risk of diabetes. Avoiding inactivity for long periods. Sitting still for long periods can increase your risk of type 2 diabetes. Try to get up every 30 minutes and move around for at least a few minutes. For people with prediabetes, metformin, Fortamit, Glymetza, others, an oral diabetes medication may be prescribed to reduce the risk of type 2 diabetes. This is usually prescribed for older adults who are obese and unable to lower blood sugar levels with lifestyle changes. Here are some medical interventions that are performed to manage diabetes mellitus. Normalize insulin activity. This is the main goal of diabetes treatment: normalization of blood glucose levels to reduce the development of vascular and neuropathic complications. Intensive treatment. Intensive treatment is 3 to 4 insulin injections per day or continuous subcutaneous insulin infusion, insulin pump therapy plus frequent blood glucose monitoring and weekly contacts with diabetes educators. Exercise caution with intensive treatment. Intensive therapy must be done with caution and must be accompanied by thorough education of the patient and family and by responsible behavior of patient. Diabetes management has 5 components and involves constant assessment and modification of the treatment plan by healthcare professionals and daily adjustments in therapy by the patient. The healthcare team must establish cooperation in implementing the following interventions. Educate about home glucose monitoring. Discuss glucose monitoring at home with the patient according to individual parameters to identify and manage glucose variations. Review factors in glucose instability. Review clients' common situations that contribute to glucose instability because there are multiple factors that can play a role at any time, like missing meals, infection, or other illnesses. Encourage client to read labels. The client must choose foods described as having a low glycemic index, higher fiber, and low fat content. Discuss how client's antidiabetic medications work. Educate client on the functions of his or her medications because there are combinations of drugs that work in different ways with different blood glucose control and side effects. Check viability of insulin. Emphasize the importance of checking expiration dates of medications, inspecting insulin for cloudiness if it is normally clear, and monitoring proper storage and preparation because these affect insulin absorbability. Review type of insulin used. Note the type of insulin to be administered together with the method of delivery and time of administration. This affects timing of effects and provides clues to potential timing of glucose instability. Check injection sites periodically. Insulin absorption can vary day to day in healthy sites and is less absorbable in lipohypertrophic tissues. Diabetes mellitus type 2.